Hey there, Dr. Andrews, board certified plastic surgeon here in Coralville, Iowa, here at the ReCenter. So again, the ReCenter is our new wellness center. It is used for sports recovery, for general wellness. And we're really excited about what we're able to offer. So we have IV therapy, we have Normatec compression stockings, both for the arm and the thighs. We have a hyperbaric chamber, we have red light therapy, we have an infrared sauna, we have a medical weight loss program. So it really is quite comprehensive to revive, restore, rejuvenate. Today, I just want to make some quick comments about the hyperbaric chamber that we have here. So the hyperbaric chamber that we have here delivers what's called mild hyperbarics, opposed to the hyperbarics that you get at the University of Iowa or at Mercy, Iowa City. Those chambers are different because the chamber is actually pressurized with oxygen. As you know, oxygen is flammable. As a matter of fact, the three things you need for a fire are oxygen, a fuel like clothing that we wear in a hyperbaric chamber, and some energy, so like a spark. And so that the fact that the chamber is pressurized with oxygen makes it a little bit more, adds a little bit more risk. And so they have all these restrictions. They require that patients don't wear deodorant or colognes or perfumes that might have alcohol. You can't take any electronics in there, certainly anything with a battery that can cause a spark. You can't wear jewelry. They don't even want folks to wear makeup or fingernail polish, and you have to wear all cotton clothing. Our chamber is a lot different in the sense that our chamber is actually pressurized with atmospheric air and not oxygen. We do deliver oxygen, but that oxygen is delivered via a mask. So you are getting oxygen at a higher partial pressure, which is what produces the results. And so this is the type of hyperbaric oxygen that's delivered, say in someone's home, or athletes will buy these devices. They actually are quite expensive. And so, Michael Jackson had one in his house, and, LeBron James uses them, and, there are many NFL athletes that actually use them as well. And so that's what we have here. So it's a lot safer, but does deliver oxygen at a higher partial pressure, which is what we need to see the salutary effects of oxygen. So here is our chamber, and so you can see it's a soft shell chamber, which is different from what they have at the university and also at Mercy, Iowa City, which is a hard shell chamber, and those chambers can go up to 3 ATA. The highest we can go is 1.4, 1.5. This actually has been rated to 1.7, so it can go to 1.7, but we don't go that high. What you can see here is our air compressor, and this is what pressurizes the device, and we have gauges so we can safely follow exactly where the air is. And then we have what's called an oxygen concentrator, and we deliver our oxygen with these masks. And so these masks are great, and so they can deliver oxygen up to about 60-70%. And then we also have these masks called non-rebreather masks, which can deliver oxygen to 80-90%. So you are getting the oxygen delivery to your alveoli, which is the most important thing, and at a higher partial pressure, which forces that oxygen into your plasma, which is precisely the way that hyperbaric oxygen works. It increases oxygen delivery to tissues by causing the oxygen gas to dissolve into the plasma. As we know, oxygen is carried to the tissues attached to the hemoglobin molecule, but that's already saturated to 97 to 100% in most people. What hyperbaric oxygen does is sort of like carbonating a liquid like a soda or champagne. It forces the hyperbaric pressure, or the increased partial pressure forces that gas into solution, and so that's what carbonates our drinks. And so you take the top off, that gas is released because the pressure decreases, and it becomes flat. What happens in the hyperbaric chamber is when you breathe oxygen and you add the higher partial pressure, it forces, it's called Henry's law, it forces that gas into the plasma. And so even in situations where there's reduced oxygen in tissues, or there's reduced delivery of red blood cells that contain hemoglobin in certain disease states, you're still delivering oxygen through the plasma. So it's actually great, been shown to be great for sports recovery, for chronic pain situations. Certainly hyperbaric oxygen is used for a myriad of reasons in the hospital setting, for radiation injury, central retinal artery occlusion, and all sorts of things. But for us, this is regenerative and restorative, increasing oxygen delivery. If you'd like to learn more, please give us a call, 319-694-6086. Thanks so much.